morning and welcome to the morning show. I'm Marshall Shore.
And I'm Melissa Farley. We're here at the fabulous Arizona Center.
And you know what else is fabulous?
What?
Word of the day.
What else is the opposite of fabulous?
All right, but you get to get out that frustration of ripping off the Band-Aid, and there you go.
It literally hits. There you go.
Oh, man, good thing I'm wearing glasses. Oh, my gosh. All right, so our word of the day is marginalia. So, marginal notes or embellishments, as in a book.
That is a no-no for me. Hate that. Ugh.
See, I'm always like, if it's my book, I'll put Post-it notes and things like that in it. But if it's a library book, oh no, I don't bother doing that.
I never write in books. I usually have like a companion notebook that I do dog ear pages. That's the worst that I do to a book. But that's funny, we were just having this discussion.
I know, it's so funny that we actually had this discussion, and it's like the word of the day is like, look, related to exactly that.
Yeah, our leadership team is like going through some leadership sessions, and the guy that was leading them was like, can we print copies from your book? Because mine is like totally written in, and I was just like aghast. Like,
right.
How do you do that? No. See, I don't like the word of the day, and I don't like the actual word of the day.
Right.
Marginalia. Whatever. Okay. Well, this has been a short and sweet intro because we want to get right to the good stuff.
Indeed.
We've got two guests here that we can't wait to introduce you to, so keep it right here. We'll be right back in just a second.
Good morning and welcome back to the morning show. I'm Marshall Shore.
And I'm Melissa Farley. We're here at the
fabulous Arizona Center.
That's right. And we also have some fabulous guests here with us today. We've got Becky and Kristin from Lively Integrated Health. Is that correct?
Yeah.
Yeah.
Thank you.
So tell us a little bit about Lively Integrated Health and what y'all do.
Yeah, so we are a locally owned and women-operated, comprehensive wellness center out of Gilbert, Arizona. And so we like to help people feel their best from the inside out, radiate wellness on the outside as well. And so we love getting to the root cause of different things going on. We love treating based on symptoms and not always just lab results, but we also definitely take lab values into consideration with that. And so whether it's with hormone balance or weight loss support or medical aesthetics, IV therapy, gut health, kind of the whole gamut of wellness services we provide.
I selfishly was very excited you were here today because I keep saying that I've started menopause, but I don't know if that's true, but I just feel like something's been off, you know, and I feel like that happens for a lot of women, and they kind of just ignore it, or they think it's going to get better, and then 4 years goes by and it's like, why am I still suffering with this, when do you find people normally, or women normally, come in and see you? What are some of the most common things people come to you for?
I would say, when we had started this, it was, about 3 years ago, as an IV therapy company.
Oh, okay.
Really grew into then bringing in the weight loss, and then realizing that underlying, there's usually something else going on. Why can't I lose this weight? Or I've been doing everything right for my whole life, and now I have this 10 pounds I can't lose.
Yeah.
And where we realized there's another problem going on. So that branched us into the whole hormone replacement therapy. So our patients usually will start kind of with, I don't know where to start. Can you tell me, where to go or what to do? These are my symptoms. We meet with you, draw your labs, and really kind of just checkpoint from there. It can be from, I want to lose 10 pounds, or why am I feeling miserable? But this is how my mom and grandma felt, so I feel like this is just how I should be.
Yeah.
And then we get down and dirty to the root cause.
Yeah, my brain is going like two different directions at the same time.
Yeah.
Part of me wants to explore the weight management support, because clearly that's a hot button thing right now. You can get weight loss meds, like go on your app and just lie and get a prescription. So part of me wants to go there, and then part of me also wants to go to the hormone therapy, because I think for a long time people were kind of afraid to even entertain and I'm like have been considering it, I would say, for over a year, but I have been hesitant because for me, like even when I take a turmeric like supplement, it affects me drastically. So I'm sitting there going, wow, messing with my hormones, that feels scary. But like, talk to me a little bit about that.
Yeah, so we definitely try and make it not scary. We embrace a lot of these same treatments that we do ourselves, and really you can start to see the declines in your hormones in your 30s, and then it just gets progressively worse and worse. We only do bioidentical hormone therapy too, which makes a big difference. So those are received by our body a lot better than synthetic hormones. So a lot less side effects, a lot less risk profile with those. And then there's multiple different modalities that we can do, whether it be pellets, creams, strokies, injections. So we really customize it to what your body needs and what your preference is too, so that you can, titrate it or adjust the dose based upon how you're feeling, based with your lab results. So we really try and make it, a not overwhelming, scary thing, because you kind of got to look at the full picture too to get the best results with everything too, for not only for weight loss, but also for just feeling well, and wondering, you mentioned wondering if you're in that, perimenopausal journey. So there is blood work we can do to determine that, and so we definitely can tell just via blood work if that's what's going on. But the whole perimenopausal phase can last 8 to 10 years, and so
which is crazy to
I know.
Like,
so
what?
I know.
It's insane. So you can either just be on a roller coaster for 10 years, or the best option is to intervene early so that you're getting those levels as most steady as you can without just riding out that journey and having so many ups and downs.
Can I ask a dumb question?
Yeah,
maybe
there's never
too?
dumb questions.
Just because I'm curious.
Yeah.
So like a lot of times when I say, oh, something doesn't feel right, because I go to Mayo, they do pretty good service. But they'll go, oh, let's get you into our endocrinologist and get your thyroid checked. Is that the same thing as the kind of test that you're running specifically for hormones?
Yeah, 100%.
Yeah? Okay.
Yeah. So our comprehensive panel includes an in-depth look at your thyroid, it includes inflammatory markers, vitamin levels, hormone levels, and then the other stuff that we routinely want to check, once a year too, cholesterol, A1C. But we dig even deeper there at your fasting insulin level, insulin resistance. So it's pretty comprehensive approach, and then we can just tailor future labs to what you need. And a unique thing too about us is we do accept insurance for the lab processing through Sonora Quest, which is a nice thing. Us at our practice don't accept insurance, but we do take health savings account or flex spending accounts, which is nice. And, try and be pretty affordable considering the amount of time and personalized care that we really give to patients, because we are just so passionate about helping people feel better. In general.
So tell me what like a first visit might look like and be like for somebody coming in who maybe doesn't know what's wrong, but just, has these symptoms or things that they've been dealing with. What would that kind of look like?
Well, once you reach out to our office, we put you on the schedule, and it's usually with Kristin and I. We do have a couple other nurse practitioners that work with us. You fill out some pre-paperwork, and we set up a free 15-minute consultation. Within that consultation, I kind of explain right off the bat, hey, this is going to be a quick get to know you. Tell me what is plaguing you the most. What do you want help with, and what do you expect from me or us as Lively? It really gives us the ability to tailor from that point on, building that rapport and that relationship, so it's a familiar face. When you meet with your initial provider, that's who you've got. Unless Kristin's on vacation or somebody's on vacation, we may ask, hey, is it all right if you meet with somebody else? But once you establish that rapport, we really try to build it onto that. Once we've met with you, we will send you for labs, and then based on that, we do a full discovery wellness visit that lasts anywhere from 45 minutes to an hour to really formulate your personalized plan of care.
That's great. Yeah. So talk to me about the weight management side of things. What does that journey usually look like for you?
So based on, once again, same thing, discovery call, then you're saying, okay, this is what I would like for weight loss. We've been doing this for 3 years, and we've been able to really vet out and see kind of what works, what doesn't work. We figure out where you want to be with your weight journey, and then give recommendations. We do a lot of the peptides, such as semaglutide, tirzepatide, but we also will do different compounding versions of medication that really fit you. We trend your labs, so you come in, you get those lab values, and then we look at it and say, okay, your insulin resistance is this, expect that it can take up 2-3 months to break through an insulin resistance wall, really to set the platform and the stage for our patients. So they're not expecting, I'm going to lose 37 pounds in a month, right? It's setting those expectations and really in that journey together. Very much concierge, which you can reach out to us and we troubleshoot things, dietary recommendations, and it's really just kind of like a friendship.
That's great, and it's nice to have that kind of thoughtful care, I think. And for the weight journey, I'm kind of curious. I think more and more as I've talked to people, there are certain individuals that are have adverse effects to kind of the peptides. Are there other options that exist for people that really don't or can't go that route?
Yeah, there absolutely is. So, I mean, tirzepatide in general is generally more well tolerated than a little bit more popular semaglutide, so we always still have that as an option. But then we also have other peptides that we can consider. So we have things like tesamorelin and ipamorelin, AOD, some different options where it's just really mimicking your body's natural functions and stimulating what we need, whether it's, visceral fat loss, there's certain peptides to help with that, or whether it is, we need your pancreas and tip-top function reversing that insulin resistance. There's definitely other options. It's not only, those most well-known peptides. And there's oral options now too, honestly, for a lot of those peptides. So if injections aren't something that you want to do, there's oral options, which is great.
I just heard about that.
Yeah, so they're awesome.
Yeah, I think it's interesting because like for me, I would say the last 10 years I've had a hard time losing weight, and so they put me on phentermine. Everyone is worried about the heart on phentermine. I have a kidney disease, and for whatever reason it tanked my kidney function, and we didn't catch it because nobody was really worried about the kidneys while I was on it. They were all worried about the heart. So then we tried Mounjaro before it was like approved as a diabetic medication. Lost my gallbladder on that one.
No.
Yeah, and so now I'm a little bit hesitant about kind of exploring that medication-based route, but what I'm getting at is I think sometimes with my care I've always felt like, well, they're not really listening to me because, I your body better than most people, and it's like, okay, I'm getting older, so I know more hormones are changing. This all started happening when I started taking Lexapro and Emgality kind of right around the same time, and literally I can work out every day, diet like crazy, and only lose maybe 3 pounds versus when I eat whatever I want and don't work out. There's not much of a fluctuation. So like I just keep feeling like, well, there's something there. But a lot of times when you go to a regular, I'm not trying to put down regular doctors, but when you go to a regular doctor, it's like, well, this is what always works. Here you go. Let's try it. And it's like, well, hold on. So I love that. It sounds like you take the time to actually listen and kind of investigate and do a holistic approach.
Absolutely.
Well, it really sounds like kind of there's that current trend of narrative medicine, of really listening to what people are saying, because sometimes they say the answer without even realizing what's going on. So, but just needing, like you said, someone to listen to them.
And everyone's individual. I think that's a big thing too. It's not just just a number. At Lively, like we get to know you by name, and we are very individualized. We also have a functional dietitian on our team too, so we do. We can approach it from a completely natural standpoint too, with just dietary and supplements. And there's some supplements that can activate your GLP receptors in a natural way too. So
interesting.
Definitely lots of different options.
I think it's just like for someone who's been down the road a couple times, sometimes you just get frustrated and you're like, I'm just going to forget it.
Your labs are fine.
You're
fine.
Well, that's what I was asking about the thyroid thing, because they did that with me and they were like, everything looks good. And I'm like, does it?
There's optimal and there's normal. We base treatment on optimal ranges and not just normal ranges. So a lot of times we can even look if you've had labs done at other places and say, oh, there's still some optimization to have, to have here. So especially with thyroid.
Okay, now I forgive me. I remember you sent in your information, and there was a third thing that you all had wanted to talk about, and it's escaping my little brain.
Probably our medical aesthetics.
That was it. I was like, it has something to do with aesthetics. I don't even know what that is, so tell me what that is.
So I think that where we grew into aesthetics was we are helping all of these people lose weight, feel great on the inside, and on the outside maybe they had some skin laxity where they weren't they felt they looked saggy, or their face, maybe felt that it was a little bit, like that Ozempic face that people would say, or drawn.
Right.
So we really wanted to focus in about getting people to feel great on the outside too. So when we talk about medical aesthetics, a lot of it has to do with, we do hydrofacials. So hydrofacials to help you glow. We do regular facials. We do Botox. We do filler. And we do have a couple machines also that help, that we love to kind of pair with the weight loss ones that Kristin can talk a little bit about.
Oh yeah, no, we just brought one of the little things. We have a M-Face device where it is fantastic at just raising these elevator muscles in the face. It also can treat double chins or the forehead.
Chin.
Yeah,
yeah.
And it's just these really, non-invasive sticky pads that we put on, and it just works on raising these elevator muscles or getting to the root, musculature here, or just killing this fat pad down here that we all struggle with. So
How does it do it?
So so it's almost like a workout for your face.
Okay.
So what it does is how you put it on, when you put it on your face, what it does is it stimulates those muscles. So you can't really put weights on your face and lift them, right? But if you're putting this on, it's doing multiple contractions, which is stimulating that to have your face muscles hold up, and helps with some fine lines and wrinkles because of the droopiness.
Okay.
And then with the cementum down here, what it does, like she says, is it also uses some heat to kind of melt that away. So when you're doing it here and here, it's pulling and melting. So it's really giving your face back that young.
a needleless facelift, they call it.
Yep.
I like that. Yeah. Well, it's funny. I mean, you guys are the experts, so you might disagree with me. But like my face, I've always been like, I'm pretty good. I don't feel like I need like Botox or anything.
Yeah.
But every time I see like pictures of me, and the chin thing, I'm like, I need to do something about that. Though.
I know. It's a common.
That's what yourself a taller photographer.
I know. Right?
Just the right angle.
Right. Exactly.
You can only angle yourself so many ways.
Yeah.
I know. I know.
Right.
And it's like right when you think you have it figured out, you're like, no, that didn't work. But no, how fabulous. Okay, so why don't you share with our viewers where people can learn more about you and book an appointment, hopefully a free consultation to get to know you a little better.
So you can visit us at Lively Integrated Health, www.lively Integrated Health. We do accept the phone number too, which is 780-480-7214, right?
Or 480-780-7214.
Sorry. That one.
Yes, I have small number issues.
We do that with each other all the time.
It's ridiculous.
That's an important one.
Can you tell them again what the number was, please?
Yes,
Sorry.
480-780-7214. And then we also have Instagram and a Facebook presence as well under Lively Integrated Health, and can directly message us on there as well.
And I like to just set expectations when we have health professionals on. Are you kind of on a really long wait list right now, or is it pretty quick to get seen? Okay.
Yeah, absolutely not. Usually within a week we can get you in.
Oh, that's great. Okay.
Yeah, absolutely.
Wonderful.
Yeah.
Yeah, I just know like for a while there when I was trying to get a therapist, it was like, 3-month wait.
Yeah.
Yes.
Like,
No, it's a good question. Yeah.
Well, thank you so much for sharing about what you do and all of the available options.
And that whole range of services.
Yeah.
I mean, I think that's what I think is most impressive, is just the range of things.
Yeah.
Yep. One-stop shop. That's
One-stop
what we
shop.
want.
Right.
Yeah.
That's what we want.
Yeah.
Content
Yeah.
experts in your area.
Yeah.
One person can't know everything, so bring in the experts.
And I love that you're not too far from me, so that's,
Nice.
again, selfishly, I'm happy
Yeah.
about that.
We would love come in and see us.
I was going to say we do offer telehealth though too for anybody that's not in the
good.
Gilbert area. So
Okay.
all of
Yep.
Arizona, and also she's licensed in Illinois as well. So telehealth
Oh,
services
well,
for
there you
anybody
go.
who's not local in the Gilbert.
Well, that's
area.
fun.
Yeah.
For those snowbirds.
Yeah, there are.
Oh, indeed.
So
Yep.
Very cool.
thank you.
Well,
guys.
thank you so much, for
Yeah,
being
thank
here,
you
both
so
of
much
you.
for having
We're going to
us.
take a quick break. We'll be right back after this. We've got history, things to do, celebrations, so don't go away.
And welcome back to the morning show. I am Marshall Shore.
And I'm Melissa Farley. We're here at
The fabulous Arizona Center. Indeed, we are. Oh, because your hair. I was
Rookie
like,
mistake.
I was like, what's that?
Crinkling.
I was like, it's not me.
I know when I did that, I was like, is that my bones? Am I that old? Like everything's just crackling?
You sound like me getting out of bed in the morning. So,
It's just my hair, guys. We're okay. We're okay.
Not old age.
Not old age. Well,
Yeah.
I mean, I feel it in my bones and my metal plate when it rains, so.
Fry an egg on it.
Yep. All right. History time.
Let's do some history. All right, we normally don't do birthdays, but we're doing the birthday of Arizona's first female governor.
Ooh.
She was called the Healing Governor because she became governor because of the impeachment of Evan Meacham.
Yep.
Indeed, and it was Rose Mofford.
Yep.
I mean, known for that beehive hairdo.
It's great hairdo.
Yeah, she was famous for that. And you know, she grew up in Globe, Arizona. She was the first female student body president there. She was an athlete. She was famous for basketball and softball. Back in the late 30s, early 40s, she was part of the Arizona Cantaloupe Queens.
What's a cantaloupe queen?
So, did you ever see League of Their Own?
Yeah.
And all those female softball players?
Yeah.
She was one of those.
That's a cantaloupe queen?
Well, it was a team she was on.
Oh, okay.
So that was the name of the team. And so...
Sound like a beauty pageant, like that's sponsored by a cantaloupe company.
I would not be shocked if there also was not a cantaloupe queen with a big sash and everything else. So she is also in the Arizona Softball Hall of Fame. And she also, most people don't realize, she first came to Phoenix, she was actually working as a volunteer at the state mental hospital.
Okay.
Because she was there at the request of the then governor, because they weren't very nice to folks with mental illness at that point.
Yeah.
And she also became good friends with Winnie Ruth Judd.
Oh.
Probably one of those infamous folks in Arizona's history.
Yeah, for sure.
So happy birthday to Rose Mofford.
Yeah. That was fun.
Indeed.
So other than celebrating Rose Mofford's birthday, what else are we celebrating today?
Glad you asked. All right, do people still use ballpoint pens?
I do.
Well, see, there you go. Then we are celebrating ballpoint pens.
Yay!
Because on this date back in 1943, Brio, a Hungarian journalist, invented and received the patent for a modern ballpoint pen. His brother was a chemist and came up with quick drying ink and that tiny little ball. And so basically it was that break away from fountain pens, leaking oil, leaking ink and smudging ink.
Yeah.
And so it created an entire revolution of getting away from fountain pens. And so there you go. So ballpoint pen day.
Yeah, I journal almost every morning and I use a ballpoint pen.
See, there you go. All right. Now, also, we're celebrating herbs and spices.
Ooh.
So, and I always wondered, it's like, what is the difference between an herb and a spice?
What is the difference?
So basically, herbs typically come from the leafy part of a plant, where spices are derived from seeds, roots, bark, or fruits.
Okay.
So I didn't realize, like the Colonel has this
Yeah.
11 herbs and spices. I was like, oh, well, there you go. And so we are celebrating herbs and spices because cultures across the globe, there are some spices that are so unique to different cuisines, but it's just a great way to just kind of get a global bit of flavor to kind of mix it up. And
I'm surprised KFC hasn't reached out to you, honestly. No, because they evolve their brand and stuff, to kind of still be hip and cool. And I took my mom there the other day, and I swear it's like he's starting to look more and more like you. I really think you're like a secret inspiration for them.
Well, it was funny because actually I had a friend who was on his way to LA to do an audition for them. And I happened to call him as he was on the road. And he was like, I should have brought you along with me.
Totally.
So
yeah. Or at
who
least
knows?
taking a picture in the waiting room of all the
of all the lookalikes.
Yeah, that would
and
have
how
been
many
funny.
of them wear the real beard or
Yeah.
the fake one.
Yeah.
So.
Sorry, side tangent.
Oh, no, not at all. No, because in case people, it's so funny because I love when people go like, oh my gosh, you remind me of the Colonel.
Well, so that's usually what I get is like the cool KFC guy. Like if they don't know who the hip historian is, like,
right.
oh, the cool KFC guy, or the hipster Santa. Like
Oh,
that's,
right,
how people
right,
know
exactly.
you.
Those are the ways they know me. All right. So next we are celebrating, okay, you can have a bartender or you can have a bartender with some flair.
Okay.
And so it really evolved out of Jerry Thomas, who was really one of the first flair bartenders of doing tricks and things with the bottles. And so that is continuing right up to in their competitions. You might be shocked to find out that it took a huge spike after a movie with Tom Cruise.
Oh, jeez.
So not shocked at all. And so today is the day we are celebrating all those bottle twirling, shaker spinning, choreography routines, and you get a pretty darn good cocktail after all of that.
You
A
do.
show and a beverage.
I was thinking about how many bottles I would break if I tried to. I'm sure you practice on like unbreakable plastic bouncy bottles.
But you need the weight, so it's kind of like
Well, they
it's
could
like.
probably weight it with liquid, but
So, also, okay, so animal crackers.
yeah.
Now, Mother's has those frosted.
Yeah.
Yeah, so today is Frosted Cookie Day.
Yum.
And so, I was so disappointed at one point they stopped making them.
They did.
And now they're back because I was like, oh my gosh, what a staple.
I thought it was funny one time I brought those as a road trip snack and I must have let them sit in my car, like we stopped
Oh.
at lunch, and they were like one big glob, like.
Well, I guess then you could just like stick your face in the bag.
Actually, it was fun because we got to the hotel and I just put them in the little mini fridge and
Oh.
then you could like pull them apart afterwards.
Like monkey bread.
Yeah.
Just sit there and pull off
Yeah. So it was
a
okay.
lion, a tiger, a bear. Oh my. So.
Turned out just fine. Just fine.
Indeed. All right. So I'm picking off the the frosted animal crackers today. What else could I be doing?
I do not even own a bike, so this one is not for me. But for all of those gearheads out there, you can join in for June Bike Night at Cycle Gear in Phoenix at 5 p.m. You can rev up your Tuesday night by joining in for Bike Night. You'll be able to meet fellow riders, check out the latest gear,
Oh,
and
not
show off your
bicycle.
ride.
So not bicycle.
Oh, it's motorcycles.
It's motorcycles. I
Crotch
was like,
rockets, as my
oh.
mother would call them.
Well, there you go.
Okay, so no bikes, just kidding. But whether you're cruising a Harley, rocking a scooter, we want to see it. Plus, you can score some deals on gear and accessories if you turn up. There's no cover, and it's from 5 to 7. So really not for me.
Yeah.
Doubly not for me.
The only way I would want a bike is if it came with a sidecar.
I know. Pat and I have talked about that a lot, but I don't
Yeah.
trust him on a motorcycle either, so I don't know.
But with a sidecar.
Well, I know, but I'd have to be in the sidecar, which means I trust him on the motorcycle.
But it's not gonna fall over because
If there's a way-
it's got that third wheel and weight.
It's gonna be like Aristocats, where my sidecar becomes unhitched, and I just start rolling down the freeway.
Just a little bit on Batman Run, they pulled the pin.
Yeah.
Whoosh.
All right. We have some Tuesday karaoke happening at La Perla Sports Club in Glendale at 7 p.m. They actually do a weekly karaoke night, and unlike us, they have tacos for Taco
I
Tuesday.
thought you were gonna say, unlike us, they have talent.
Well, that too. Tacos and talent. So they're going to have some Taco Tuesday specials as well as some drinks. It's going to be going all night long. You can come on out and party. There's no cover. And again, this is from 7 to 11 p.m. We've got Haunter Trivia Night at AZ Haunters in Scottsdale at 6:30 p.m. You can test your wits with some spooky trivia. catch up with some fellow haunters and enjoy tasty bites and beverages. They do have limited space available, so you need to RSVP in order to join in on this one. And it is a free event, 6:30 to 9 p.m. You will get the address sent to you after you RSVP. So very mysterious.
Very mysterious.
Yes.
Probably in a dark basement somewhere.
It's probably the whatchamacallit with the dolls. Like how unimpressed I sound by now.
But the dolls are haunted.
This one sounds interesting. It's the hidden meaning of dreams at the Cesar Chavez Community Center in Phoenix at 6:30 p.m. So if you've wondered, is there a deeper significance to dreams that is being lost in translation? Some do believe that dreams are nothing more than just a brain's mechanism for processing random images and experiences throughout your day or your life. But other people believe that they can be full of deep meaning and significance and maybe even serve as a window into the other world. So you were invited to join in on a conversation about the perspectives and underlying truths that unite everyone in the dream world. So this is from 6:30 to 9 p.m. It is totally free to attend and all ages are welcome. And last but not least, we gotta have a little bit of trivia. So it's Avatar: The Last Airbender trivia at Snakes and Lattes in Tempe at 7 p.m. Whether you're Team Air Nomads, Earth Kingdom, Fire Nation, or Water Tribes, you can join in on this fun trivia night. And this will, I don't know what this says. This will only cover the anime series only. I don't know what that means, but it's starred and looks important, so I'm just going to say it.
So how would you do on this trivia?
Not well.
Yeah, I wouldn't do well.
I would not do well on this one. Yeah. So depending on your team size, it's anywhere from $12 to $70, and it's from 7 to 9 p.m.
And you don't want either one of us on your team.
You don't want either of us on your team unless you just want us to say snarky things and egg you on. I don't know.
Drink, 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 drink.
Chow, chow, chow. Yeah. But there you have it. There is your Tuesday night. Some fun options.
Indeed. So we have no tacos, but you have a place to go get tacos.
That is correct. Yeah.
So
tacos and karaoke.
Indeed.
And drinks. I would need drinks to do karaoke. I don't think I could do sober karaoke.
Oh, I haven't. It's fine. It's fine. It's just.
Well, that's because you have no shame. No.
Well, pretty much. I'm like, well, see, I always like to choose songs that I don't know, so it makes it even more painful for everyone in the room.
See, okay, so that's the goal then, is just make it as bad as possible.
Oh, very much
and
so.
if you make that the goal.
Yeah, no, that is the goal.
Okay. I like that. Way to reframe it. Well done. Take that pearl of nugget for your Tuesday. We're going to end with that. The wisdom of Marshall. All right, well, if you have anything you'd like to send in to us, events, shout-outs, partner with us, anything, where can they do that, Marshall?
You can do hello@onthemorningshow.com or Instagram @onthemorningshow, because we love to hear from you. We want to hear about your events. Maybe you got something to celebrate. We want to celebrate right there with you because we love local.
Also, we're giving you just a little bit of a heads up. We are actually going to be taking a bit of a break for summer, give our team some time off. And when we come back, we're going to have some changes, some new things. It's going to be totally fresh, all new and exciting, but still.
Maybe we'll have all new faces from our guest.
All new face. We're getting plastic surgery. That's really why we're disappearing. No. No. We're doing some traveling, taking some time off, and doing a little bit of a reset.
Yeah.
But you're going to love it. We're still all things local obsessed, local love, and you're going to see that shine through even more. So, if you miss us while we're on break, you can always catch up on older episodes. They're all up online.
Or just email Anne and let her know how much you miss us.
She'll send you videos of her dancing. It'll be really helpful during that time off. Yeah. All right, so we've got a couple more things for you before we take our time off, but we just wanted to let you know that that's coming and to not be scared. We're not disappearing forever. We are coming back bigger and stronger.
Indeed.
So we hope you have a great Tuesday, and we'll see you right here.